Hi, my name is Jessica Chastka, and I'm a pelvic floor physical therapist at Lady Bird Physical Therapy. This is part 3 of our YouTube series about prolapse. And so what I'm going to do today is talk about what can you do for a prolapse besides surgery. Okay, so the first thing, pelvic floor physical therapy. You knew I was going to say that though. So what would we do in PT? Of course, you get a full body assessment, and a lot of what we'd be looking at is what is the prolapse, like what grade is it? What's your tissue laxity like in your pelvic floor and abdominals? What is your tension like in your pelvic floor and abdominals? What is your strength like in your pelvic floor, abdominals, but also your glutes, hip rotators, hip flexors, all the muscles that support the pelvic floor. In addition, working on like balance, things like that. But like I said in the last video, it's not all about pelvic floor strengthening, although it is a piece of it. It's likely that someone needs a combination of all of those things. I think where people get stuck is just doing kegels. So a good pelvic floor physical therapist is going to take that into account, but also look at all the other factors and figure out like, why do you have that prolapse? How can we prevent this from getting worse? And so that takes us to looking at the intra-abdominal pressure. So that oftentimes is managing constipation, it's managing how we exercise. Are we breathing correctly during exercise? And sometimes it's a lot of times not something people thought about before, but now need to once they're like having symptoms. And so a PT can look at how you're doing exercise and help you do it in a way that doesn't aggravate your symptoms. Okay, so strengthen what needs to be strengthened, reduce the tension that is there that needs to relax, because let's take the pelvic floor for example. If we want to strengthen it, but it's kind of chronically tense or tight or shortened, we need for it to be able to relax in order to squeeze. Okay, and so sometimes people who have a prolapse have tense pelvic floor muscles that are trying to like provide support to that laxity and protect the area. And so sometimes it's a little bit of both. Again, it's not just like about the Kegel. And the other things that we talked about, reducing abdominal pressure, addressing constipation, and then progressing you back to the exercise that you want to do. And that's essentially what you would get in PT. And granted, PT is going to look different person to person to person, depending on what your symptoms are, maybe what your prolapse is, your specific impairments and history. And so I would say almost like no two are alike. Okay, so conservatively, not to get surgery, PT is what you should look at. Another thing a PT or your doctor might recommend is pessary. Okay, so pessary is a device that you insert vaginally that provides support to the pelvic organs, and it can immediately take away those symptoms of heaviness. Sometimes it doesn't always, it's hit or miss if it's going to address the leakage, but it for sure can address that heaviness. And depending on what kind of prolapse you have, the grade you have, this can be an appropriate option. You have to go to your doctor, your OBGYN or like nurse practitioner, whatever will fit you for the pessary. But that helps, I think, for a lot of people reduce like the fear of movement, and it definitely eliminates symptoms. The problem is that it doesn't necessarily mean that if you wear the pessary for a period of time that it fixes it. It's a little bit more of like a symptom management at that time. Right now the research isn't necessarily showing us that long term that it's fixing the prolapse per se, but I think that's because of other factors, like it would be hard to wear the pessary for maybe that long. There's just not the right like combination of things that we found that make the pessary alone helpful in the long term. Meaning that as long as you're wearing the pessary, it's helpful, but when you don't, it might not be. However, I think this is something that we used to look at only for like little old ladies with a prolapse that were never going to have sex again, and that's not true. I've had many young women use a pessary to help them get back to exercise more comfortably. And so I think that's an option that you can talk to your PT about, you can talk to your doctor about if surgery is not something that you want to have, because not everyone with a prolapse has to have surgery. Some people will, and so that's not to say that if you had surgery that it's a failure. It's just more of like not everyone needs surgery to address a prolapse. And so thanks for listening. That is our third video on a prolapse, and today we talked about how to manage a prolapse conservatively.